Hello students, I'm the OG Guru Dr. Punit Bhojani here. Welcome to the channel, and in today's video I am going to discuss very important image based questions for the upcoming NEET PG. I am here with a single point agenda to make OBGY your most favorite subject and most scoring subject. And before we proceed, do not forget to check out the NEET PG strategy video which I have put out on the YouTube, where I have given the last 40 days strategy along with very important tips how to boost up your grand test score. So please check out that video also on my YouTube channel. Do not forget to get in touch with me on phone and WhatsApp on this number for your timetable guidance, anything what you require. Now, before we proceed further, please also install the OG Guru app on Android and iOS. For iOS, you need to put the ORG code YYMSTV. And my dear student, this is your last chance. So many students joining every day. They're extremely happy and they said that, sir, my performance in OBGY has been boosted tremendously by this rapid revision course. And just in 10 to 12 hours time, you will be able to revise the entire OBGY under my guidance. More about this later on. Now, moving on to the first image based question. Now, my general instructions, please pay attention. Whenever you get an image, do not rush in. First, please observe the image for 10 seconds. See what the image is trying to tell you and identify whether it's X-ray, HSG, what it is and what it is trying to show, what part it is trying to highlight, and then also look at the options, and then you should be able to get it correct. So now point number one, what is this showing us? Yes, this is a HSG, hysterosalpingography. This is also a very expected question in this year's NEET PG. So virgin MCQ, so it's a HSG. But now, what is it trying to show you? So whenever, first very quickly, the normal HSG, it is going to show us a triangle cavity. So the uterus always appears triangle, the normal uterus. And then you see one tube, left, right, bouncy, wavy tube. And then we get the spill of the dye. That means the tubes are patent. It's the initial investigation for tubal patency. Please comment in the chat box which day of the cycle generally the HSG is performed. Now when you look over here, yes, the uterus is appearing okay, triangle. We can see the tube all the way up here. We can see this tube also, but can you tell me? So it is not a bilateral cornual block, because bilateral cornual block, we will only be seeing the uterus. So I'll teach only not one MCQ. With this one image, we are teaching you so many other extra important points. Bilateral cornual block, the tubes are blocked at the cornual end. So we get to see only the uterus, and the tubes are not seen only. That is your bilateral cornual block. Now over here, please understand this. What should a normal HSG be like? The normal HSG, complete opacification. There should not be any filling defects. The uterus is well opacified in a normal HSG. Okay, it should look like this. Okay, now here if you focus, my dear students, what is it? Yes sir, there are so many. There are multiple filling defects. That is the main part of this HSG. So it is not a normal HSG. Bicornuate and septate. Also I'm going to tell you very important clue, short MCQ for the upcoming exam. So this, my dear student, is a multiple filling defect. Just by the way, we can also get a solitary filling defect. If suppose there's a fibroid, submucosal fibroid or a polyp, we get a solitary filling defect. And because of Asherman syndrome. What is Asherman syndrome? Yes sir, intrauterine adhesions. We will get this multiple filling defect. The answer over here is this HSG is most likely suggestive of Asherman syndrome or multiple filling defects. And please comment in the chat box, why do I get this Asherman syndrome? Asherman syndrome is intrauterine adhesions. Why do we get it? And what is the best management for Asherman syndrome? I'll give you the answer in the chat box. Please comment, all of you, that for Asherman syndrome, what is the best management? How are we going to approach it? And Asherman syndrome, why do we get it? Okay. So please understand this. This is a HSG, but it is not a normal HSG, because normal HSG would look like this: triangle uterus, well opacified, no filling defects in the left and the right tube with the spill. This is called as the spill of the dye. So it is a test for tubal patency. Stay right till the very end. I'm also going to tell you HSG is the initial investigation. I'm going to also show you one of the gold standard or the best investigation for tubal patency in the upcoming images. So please see the whole video and also share this video with all your friends and colleagues, and do hit the like button and also subscribe to the YouTube channel. Okay, so moving on, that is the next. Now please understand this I wanted to show you very common mistake and total confusion by bicornuate versus the septate uterus. Now please understand this. What is this? So this is again a HSG, hysterosalpingography. Again, okay, the tubes, okay, the main part is something over here you need to focus on. Now what is this? Please understand this. Whenever we see two things, whenever we see this one and two separate things, there's always going to be a confusion. Sir, is it septate or is it bicornuate? Is this understood? Of course, the confirmatory. So all this Mullerian anomaly, the confirmatory is by hysterolaparoscopy, okay, bicornuate uterus, but the HSG is not confirmatory. Okay, HSG is not confirmatory, but at least we can get an idea now what it is. So please understand this, my dear student, that septate uterus, the logic is what, that the septum is protruding within the cavity. This is the septum, like this. Okay, septum is protruding into the cavity. Please understand this. So septum is in the cavity. Okay, so when I will do the HSG, what will it appear like? It will appear like this. All this, of course, where the septum is there, that will not get opacified. Isn't it correct? Yes. So it will look like something like this. आपको uterus ऐसा दिखेगा. Okay, it will look like this. So how the image will come on the HSG? I told you normal uterus is triangular, but here you will get something like this. Here you will get something like this. Okay, you will get something like this. Now how? Please understand this. Bicornuate uterus is a fusion defect. There are going to be two horns. There are going to be two horns widely apart. तो क्या करना है? Please pay attention. It is very difficult in your exam hall, but yes, we have to look at this angle. We have to look at this angle, and if this is a acute angle, yes, this is a acute angle, and therefore you will mark this as a septate uterus and not a bicornuate. Is this very important? Understood? Clap if you feel happy. So when you get two horns or two cavities which are nearby and they are having an acute angle, then please measure this angle, then that is a septate uterus. Bicornuate में क्या होगा? Yes sir, the bicornuate will be two horns wide apart, one horn like this, one horn like this, and therefore now if I measure this angle, the angle is going to be a obtuse angle. Is this understood to all of you? So whatever part, because if you can see over here, septate may the two parts are going to be nearer each other because its septum is protruding the cavity. So here you get a acute angle. Bicornuate is a fusion defect, two horns wide apart, and therefore the part you are going to get a obtuse angle. Clap. Surely coming in the upcoming exams. Thank me on the day of the examination and you will remember me, is my guarantee. Moving on. Now again we see a sonography. Sonography, you can see, make out that sir, this is the fetal head, nose, and something to do over here, and specifically the baby ka upper portion of the baby, the upper portion has been zoomed in. So what is this sonography? Yes sir, this is the NT scan. Okay, Please comment in the chat box when is the ideal time or when is the NT scan done. Please comment whether it's in the first trimester, second trimester, when specifically in the first trimester. Now, what is this NT? Yes, sir. It is one of the marker for trisomy 21 Down syndrome. And one more better name now. NT scan everybody knows. My student, can you see this? Yes, sir. This is also the nasal bone. This is the nasal bone. Tell me what is importance of this. So nowadays the name is NBNT scan. That is the identification. So what it is, please pay attention. Every baby, okay, so this is the baby, this is the nose, this is the mouth like this, okay, and then this, okay, like this, and the baby looks like this, and the umbilical cord, right? So we focus over here and zoom in, and every baby at the nape of the neck, every baby at the nape of the neck has some translucent space. Okay, every baby at the nape of the neck के पास थोड़ा सा translucent space होता है. What we do, sir, we have to put the caliper over here, we have to put the caliper over here, and this space which is there, that I have to measure. And how much should it be? Yes, please understand, it should be 1 millimeter, okay, 1.5 millimeter, 2 millimeter, all that is normal. Is it understood to all of you? Why? Because increase in NT, increased nuchal translucency is a marker for trisomy 21 or Down syndrome. It's a soft tissue marker. It's not a confirmatory, it's a marker. It gives you an idea that yes, baby can have Down syndrome, and yes, up to 3 millimeters is considered normal. Okay, so 3 or 3.5. So NT should always be less than 3 millimeter. So 1, 1.5, 2, 2.5, all this is okay. It should be less than 3.5 or less than 3 millimeter is what you need to remember. And also important point is that if the baby has Down syndrome, what another point? Absent nasal bone. Okay, absent nasal bone. So increase in NT, 2 MCQs done. Increase in NT and absent nasal bone are the two features of Down syndrome on ultrasonography. Is it clear to all of you? Please repeat after me. Increase in NT more than 3 to 3.5 millimeter, and absent nasal bone. So here you can see that the nasal bone is present. So nasal bone is also okay. And this, my dear student, if you zoom in, okay, so this you can see over here. This is what I was talking about, this translucent space. This is NT. They'll tell you this is 1 millimeter, 2 millimeter. So this is normal. If it is increase in NT, it will be like a very big space. So it will be not like this. Kaise hoga? Sir, instead of this, I'm just giving you an example. Sir, instead of this, suppose it is like this. Okay, so as if the baby is sleeping on a water cushion. So ye aapka example NT आ गया 4 millimeter, 5 millimeter. So this is increase in nuchal translucency. Okay. So NBNT scan, very important image, marker for trisomy 21. NT will increase, nasal bone will become absent. Here you can see the nasal bone. Okay, so this is a normal. This is normal. The NT value, they will tell you 1.5 millimeters. So this is a normal NT scan. At your level, they'll just tell you, okay, what is this? Identify. Sir, NT scan, better NBNT scan. Normal, abnormal is PG level. They might not ask you this. But value we should know very well. Is it clear to all of you? And as I told you, please comment in the chat box when is the ideal time or what is the best time to do this NT scan. When do we do it? Moving on to the next thing. Identify this. What is this? Okay. So please understand this again. If you look at it, sir, we are seeing the cervix. This is the speculum. Okay, this is the speculum which we have inserted. Okay, rim of the speculum. Okay, so it is not a hysteroscopy. Sir, in hysteroscopy we see the cavity of the uterus, isn't it? So here hysteroscopy nahi hai. Similarly, this is not a pap smear being done or a liquid based cytology. Liquid based we see a brush. The brush is rotated onto the cervix. So what is this? Now what is the speciality, my dear student? Ye picture kya hai? If you look at the picture carefully, please understand this. How is the whole picture looking like? Anybody? ये पूरा picture का कौन सा tint है? Okay, yes, ये पूरा picture कौन से color का लग रहा है? Yes, is the whole image is looking green, isn't it? Green. So is it the cervix of a Hulk? Lady Hulk, she Hulk ka cervix hai? No. What is this? Why is the whole cervix or the whole image appearing green? Yes, clearly. Yes, sir, because this is a image of green filter, and green filter is used in colposcopy. So please understand this difficult exam hai colposcopy plus with green filter. Now what is all this filter business? Please understand this. So colposcopy, we just examine the cervix, and what all do we get? And before that also, please comment, we apply something on the cervix, okay, and we get some area, and from there we can take the biopsy also. So what do we apply on the cervix before doing colposcopy? Some acid you apply, okay, clue I have given you. So please comment. So now please understand that first we see with a normal yellow light. Green filter is nothing but a green color light, okay. What is the funda? Please understand this. Let's say we see the cervix normally initially with a yellow light or a normal light, and then I just apply a green color screen. We apply a green color screen, and that is called the green filter. So the light which goes on the cervix becomes as green in color. And what is the logic of this green filter? So sir, this is the cervix, this is the anterior lip, this is the posterior lip, this is the cervical opening or the os. So what is the logic of this green filter, my dear student? Physics principle, and the blood vessels which are red will appear better with the green filter. So green filter is to check out the blood vessels. Very important MCQ. Why? Because sir, if it is cancer, what is one of the feature? Neovascularization, isn't it? New blood vessels, okay, and they're like a punctate, okay. So this blood vessels will be better seen when you are having a green filter. So you just have to remember, green filter is a part of your colposcopy. First you put a normal light, फिर उसके आगे green color screen, तो green filter, and green filter is best to see blood vessels, because you know neovascularization is a feature of cervical cancer, okay. So this is a colposcopy with green filter, very important virgin MCQ. All those who know me what is the virgin MCQ. My terminology, MCQ not asked till now but will come in the future exam, okay. So it's a very important exam for the upcoming exam. Image, keep in mind, green filter and colposcopy. Moving on to the next short image. Now what is this? First of all, my dear student, what is this? Is this NST or is it CTG? Okay, many students don't know the difference between NST and CTG, okay. So please understand this. NST, non-stress test. Cardio CTG, cardio topography. Okay, so please understand this. Again, a trick. Whenever I see only a single image, okay, NST, you get the zigzag pattern, and normal NST, you should know the criteria for reactive NST perfectly by heart. So when I see a single image, NST, my dear student, the difference is, sir, NST is done in the antenatal period, when the lady is pregnant, 35, 36, 37, 38 weeks before the labor starts. And CTG में क्या होता है? Sir, C मतलब cardio, cardio मतलब the baby heart rate or the baby का, and T मतलब toko, toko tali all of you, toko. So toko means the uterine contraction. Why? Because sir, when the uterine contraction will increase, the intrauterine pressure will also increase. So here you can see, sir, uterus is relaxed, फिर contraction आ गया. And again uterus is relaxed, and again there is a contraction, and again uterus relaxed, again there is a contraction. So we can make out, if I ask you how many contractions, sir, I can suppose it tell you this is 10 minutes. How many contractions? Sir, 1, 2, 3. PG level knowledge, okay. So please understand this, okay, sir, in NST you will only see one graph, okay. अगर आपको सिर्फ वन ग्राफ दिखा, which is the baby heart rate, and also you will know baby heart rate. Why? Because 110 to 160, okay, 110 to 160 is the normal fetal heart rate. 120 to 160, old criteria, wrong, okay. Please remember, 110 to 160 is considered the normal fetal heart rate, and baby heart rate will always be like a zigzag. You will always see the zigzag movement, zigzag, whether going up or down, okay. And the second graph. So when you see only one image, in the exam, it is NSP. But agar uske niche you are seeing the second graph which is having the uterine contraction, then that is your CTG, cardiotocography. Is this understood? Clap. Okay, so here sir we are seeing two things. This is the fetal heart rate, or the fetal heart rate ka recording, and this is the uterine contraction. So this is the CTG, this is the cardiotocography. But ये क्वेश्चन नहीं है, क्वेश्चन और भी उसके ऊपर डिफिकल्ट कि चलो ये CTG है. But now what are we seeing? Yes, sir, we are seeing the heart rate is dropping down. ये heart rate is going down. Then again normal हो गया. Then again heart rate is going down. So what is this? Sir, this is your deceleration, opposite. So this is a deceleration, and now PG level, early, variable and late. What type of deceleration is this? Okay, so please understand this. If you see what is happening is, okay, sir, the baby heart rate, when the uterine contraction starts, the baby heart rate is going down, starts to go down. When this peak of contraction is reached, here we get the lowest point. This lowest point is called nadir. क्या? NADIR, PG level. Okay, so this lowest point is nadir, and sir, again when the contraction is over, the deceleration is also over, and the heart rate is recovering. So exactly same thing is happening over here also, everywhere. So this, my dear student, matlab what am I saying is, okay sir, contraction start, heart rate starts to go down. Peak of contraction, you can see again over here, peak and nadir. Okay, nadir, NADIR, nadir and peak are corresponding. So this is a mirror image. Whenever the fetal heart rate, the baby heart rate and the contractions are in mirror image, that, my dear student, is early deceleration. And please comment in the chat box which condition, when do I get early deceleration in cardiotocography? What is the cause for this early deceleration? Okay, so this image, cardiotocography, normal heart rate, you have to remember this here heart rate is going down. So sir, this is a deceleration, but I still want a better answer. Sir, this is a early deceleration. Why? Because of this mirror image, what I told you. The fetal heart rate again drop, that means sir, contraction start, heart rate drops down, contraction over, heart rate has also recovered, and peak and the peak and the trough, or the peak and the nadir, are matching or corresponding. That is the mirror image early deceleration. Clap if you have learned something new. Okay, moving on. What is this? Okay, so again when the image comes, this was again asked in the recent NEET PG, surely likely to be repeated. अभी ये क्या है? Okay, first just decipher. So sir, in this image, the baby legs are out, buttocks are out, and what is inside? Head is inside. Okay, so basically ये क्या है sir? This is a breech delivery. Logic, simple, yes or no, breech delivery है, and head is inside, so we are delivering the after coming head, isn't it? After coming head ka delivery is being shown to you. Now everybody, can you see this forceps blades? Can you see this? Sir, the instrument is applied over here and this forceps blade is there. Yes sir. So this is a special instrument, and this, my dear student, is the Piper's forceps. Piper's forceps is the best way for vaginal breech delivery for after coming head, because there's least injury. Okay, sudden decompression is avoided, and injury to the brachial plexus is the least for the baby, and therefore for fetal safety, Piper's forceps is considered one of the best method for breech vaginal delivery for the after coming head of the breech. Okay, so what you do is that the assistant, this is the assistant, they're not going to ask you ye haath kiska hai, this hand belongs to whom, okay, but is the assistant. So first the baby, once the baby delivers, once the head is still inside, the baby is like this. Okay, so the assistant head is still inside the vagina. Okay, so the assistant will hold the baby by the legs and bring it up. So the baby is now parallel to the ground. Superman, baby becomes like this. So like this baby, and from the baby's anterior aspect, now you apply the blade and get the baby out. This is the Piper's forceps. And please comment in the chat box. Suppose I don't apply the instrument, I don't apply the forceps, but I just hold the baby by the lower limb and keep on pulling the baby up. I get it up, and then the head pops out like this, which is that maneuver. Also, that has been asked in the NEET PG. I repeat, okay, sir, if I hold the baby by the lower limb and I rotate the baby up towards the maternal abdomen so that the fetal head delivers without applying forceps. Without forceps, what is that maneuver? Okay, so I repeat two things which we should know. Okay, sir, one is this forceps being applied, Piper's forceps. This is the best way. Why best? Because for fetal safety. Okay, undue injury to the baby is the less, brachial plexus injury is the least. So after coming head, breech delivery, there's only one forceps, the Piper's forceps. Okay, so please keep this point in mind. Very important image. Please stick this image in your brain and you will get all the marks. Okay, now moving on to the next picture. Now what the students see? Directly they see, sir, this blue, methylene blue, and the answer, hysteroscopy with methylene blue. Very good. Yes or no? Wrong. Clean bold. Okay, please understand this, that with hysteroscopy we never use a blue color dye. So now what is this? Is this hysteroscopy? No sir, this is not a sonography. Sonosalpingography is a ultrasonography. This is not an ultrasound image. Ultrasound, you know, black and white. This is the actual image. What are we seeing? Sir, we are seeing the uterus. This is the uterus. This is the fallopian tube. Similarly, there are two images showing the same. So this is the uterus. This is, we have held the fallopian tube. This is the fallopian tube. This is the ovary. Okay, and we are seeing this blue color dye. Yes, my dear student, this is the methylene blue dye. This is a methylene blue dye. But this is a laparoscopy image. This is a laparoscopy image. Laparoscopy means we are going on the terrace of the building and seeing from outside. Hysteroscopy is inside view. Hysteroscopy के साथ we never use methylene blue dye. Hysteroscopy is to visualize the cavity of the uterus. Okay, my dear student, hysteroscopy is to see the cavity of the uterus. In laparoscopy, we put in a telescope through the anterior abdominal wall and we see the uterus from the outer side, and uterus we see, the fallopian tube we see. Okay, and now of course we see the ovary also, all that we see. And now over here what will happen, my dear student, if the assistant will take the methylene blue dye, the methylene blue dye is injected through the cervix. Okay, this methylene blue dye, you push it into the cervix, through the cervix. Through the cervix we push the methylene blue dye, and what will happen is that, sir, if the tubes are patent, the blue color dye from the cervix will of course enter the uterine cavity, enter into the fallopian tube, and we get this blue spill. Okay, and everybody start jumping in the OT. Blue hai, pani. So you see a blue color dye, coming out. So there's also the spill of the dye. So this, my dear student, is your laparoscopy chromopertubation. Chromo means color, pertubation means to put it into the through the fallopian tube. So laparoscopy chromopertubation, of course it is done with methylene blue dye. Okay, so laparoscopy chromopertubation is done through the methylene blue dye, is done with the help of methylene blue dye only. okay, is done with methylene blue dye. And this, my dear student, is the best investigation, okay, or the gold standard or the confirmatory. I told you. So gold standard or the best investigation for tubal patency. HSG is the initial investigation, but laparoscopy, okay, laparoscopy and so laparoscopy, it's understood. Chromopertubation is an extra step. What you do? Chromopertubation. Laparoscopy, chromopertubation done with the methylene blue dye. This is the answer over here. Okay, so we can see from the terrace, from the outside, so I can see uterus, ovary, tubes. This is not a laparoscopy tubal sterilization. In laparoscopy tubal sterilization, we put that white color bands. Bands are put on the tube. This the tube is held. We're just checking the spill off. You can see clearly blue, 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 blue. So this is done for infertile patient as a test for tubal patency. Okay, so do not directly see the blue color dye, methylene blue, and mark this. It is not a hysteroscopy with methylene blue. It is laparoscopy with methylene blue. Laparoscopy, chromopertubation. Both mean the same thing. Either you say laparoscopy, okay, we say laparoscopy with methylene blue, and that is a laparoscopy chromopertubation. Is this understood to all of you? Moving on, what is this? Yes sir, uterus, very good. But again, uterus में क्या है? Okay, uterus में क्या है? All this thing, please see. Sir, uterus is having all this blue, 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 bluish, purplish in color. So what is this? And which condition do we get this? तो ये क्या है? Yes, please understand this. Please understand this. Okay, sir, this is a Couvelaire uterus. Okay, Couvelaire uterus. The diagnosis is made only on the operation table when you open up the patient. Okay, it's a visual. MRI, USG, CT scan से नहीं पता चलेगा. By looking at the uterus, you will see कि oh, all this you can see, all this bluish color, all this you can see, all this sir, this uterus has become bluish, purplish in color. Now, when do we get it and why do we get this? Okay, so please understand this, that sir, suppose if this is the uterus, okay, this is the uterus, and which condition do we get it, my dear student? Yes, sir, suppose if it is a abruption. In abruption, okay, the placenta has detached. The placenta has detached from its normal position. That is abruption. While the baby is still inside the uterus. Okay, that is abruption. And now suppose this is blocking. This placenta is blocking the blood from coming out. So it is seen in concealed abruption. Okay, what happens? Please pay attention. This is the blood which is collected inside the uterus, and because the blood is not able to come out, concealed abruption, the blood goes retrograde. The blood goes retrograde in between the muscle fiber, and uterus starts appearing bluish, purplish in color. Is this understood to all of you? So this, the uterus looks bluish purplish in color, also sometimes described as the mulberry uterus. Okay, so ऐसा uterus में आप देखते हो. Okay, तो ऐसा bluish purplish you see. So my dear student, this is the Couvelaire uterus, and easy to remember. C for Couvelaire, C for concealed. Yes, if it's revealed abruption, all the blood comes out. You don't get this. Okay, so it is seen in abruption, yes, but better answer, concealed abruption is when you see this Couvelaire uterus. Is this understood to all of you? So uterus bluish pad gaya, again very likely to be repeated. And now please tell me, what is the treatment for this? What is the treatment to be done? What you tell the sister? Sir Nirma, don't tell the sister, sir give me sister, OT staff, give me Surf Excel, Nirma washing powder, and please dho dala. So please don't need to wash all this color. Okay, kya karna hai? What is the treatment? Nothing. If the uterus is very well contracted, just reposit the uterus back, means to deliver the baby out. At the time of C-section, you will notice, oh, this uterus is full bluish. So there was a concealed abruption. If the uterus is well contracted, just reposit the uterus back in, close and come out. What will happen? Yes, sir, this will resolve on its own. No treatment. You don't need to remove the uterus. Any student told me, sir, remove the uterus. No, wrong. Okay, a blue color apne aap, it's like a bruise, like how when you fall down you get a bruise, bluish purplish color theek ho jayega. This will also resolve on its own and no treatment as such is required. Okay, and also comment in the chat box, okay sir, very important, when it's bleeding in third trimester, please comment how will I differentiate between a bleeding of abruption and placenta previa. How will be the placenta previa bleeding and how will be the abruption bleeding? One or two very important points you should know. Please comment in the chat box, I'll give you the answer over there. Okay, moving on. So this is your concealed abruption Couvelaire uterus. Now all of you, my dear student, please look at all this completely beautiful colored notes, simple handwritten notes with all the integrated images, and once you have seen the video you will be able to revise the entire notes in 2 to 3 hours is my guarantee. That's what every student has told me. And my dear student, please see what all every student has said. Okay, sir, OBGY was very, sir, all the questions came as how you had taught us. Sir, the MVP MCQ, your coaching helped me a lot towards the end. MVP MCQ, sir, OBGY, bilkul you can makhan. And all the questions were from your, sir, the book and your videos and the notes, and the MVP MCQ really helped me. And all questions were from there. So my dear students, the best chance, just in 570 rupees. Okay, launched a teaser discount coupon just in 570 rupees 1 month. You will also be getting free extension till the date of NEET PG. Okay, till 15 June, and this will include all the MCQs of your previous year question, all the virgin MCQ, expected MCQ, all this image based question, instruments, everything I've discussed, along with my, of course, doubt solving mentoring and also handwritten notes. So this 1 month validity, this will really boost up your success, and you will remember me lifelong is my guarantee. As I said, minimum, if with your current knowledge you are getting 10, 11, 12, 13 MCQs correct, after this you will can boost up your score to 18, 19 MCQs correct. I don't need to tell you the importance of 28 marks. And this, my dear student, you will only require 12 hours. Okay, exactly in 12 hours, in less than 2 days time, you will be able to master OBGY and revise the entire OBGY just in 12 hours time with this course. So it's a rapid revision MVP MCQ discussion course. Please go for it. Get in touch with me on phone and WhatsApp for this number. If you have any difficulties and doubt, I'm there to help you out. And also do not forget to subscribe to the YouTube channel and follow me on Insta for regular updates. Here's wishing you all the best and best of luck for the upcoming NEET PG examination.